Good day, I welcome you back. Dr. Scott, your online headache doc, the only doctor of any kind certified by both the American and International Boards of Commonsensical Medicine. Welcome to this week's episode of Relief at Last, what your doctor won't tell you about your migraines, your headaches, and your pain. Question of the day. Despite already seeing a neurologist, a pain management specialist, and my primary care doctor multiple times for my ongoing migraines, my doctor is insisting that I return to the neurologist yet again. What do you think? Well, let me give you the answer right up front. A neurologist is not a migraine and headache specialist. Let me say that again. A neurologist is not a migraine or headache specialist. In my day-to-day practice here at Headache Relief Center, we have a wonderful group of neurologists, pain management specialists, primary care doctors, chiropractor, physical therapists, many different amazing specialists that we work with day in and day out. And in our medical system, as you may very well know, the neurologist seems to be the go-to specialist when you continue to battle your ongoing migraines and have no significant long-lasting relief. And the reason for this, in medicine as a whole, migraines in particular and many other types of headaches are automatically classified as neurological disorders. And for those of you that have heard me speak for any period of time, you will hear me say this time and time again. I run a research-based migraine and headache specialty practice. It's all that we do, and it's what we do best, quite frankly. 100% of my practice is migraine and headache disorder related. Now, despite decades upon decades of proven, published medical research, migraines continue to be classified as a whole as a neurological disorder. This is absolutely wrong. Let me give you a couple of examples to kind of demonstrate this point. Many of you, and this includes myself, have visited a neurologist for your migraine or headache disorders. And usually there'll be a series of tests, likely neurological testing, sometimes an imaging study, maybe an MRI of your brain or of your head. And in the vast majority of cases, and in my day-to-day practice, well in excess of 98.5% of the neurological testing and MRI studies of the head are unremarkable. In other words, they are quote-unquote normal, meaning they do not show signs of a true neurological disorder. They do not show or demonstrate the reason that you're having migraines and headaches that continue. So, how can we name a migraine or a headache a neurological disorder when all neurological testing and imaging studies are normal? It's not a true neurological disorder in most cases, but rather a neuromusculoskeletal disorder, meaning neurological type symptoms. So certainly when we're battling migraines and headaches of any type, our symptoms can be classified as neurological type symptoms. Certainly that's true. However, there is rarely a neurological cause to that problem. So if we were to evaluate someone with a true neurological disorder, we would find, inevitably, some kind of positive neurological testing that demonstrates or shows the real, true cause of your migraine or headache symptoms. Or if we do an imaging study of your brain or of your head, and that imaging study, MRI for example, shows some kind of obvious lesions in the brain, that would be indicative of the possibility of a true neurological disorder. And certainly on rare occasions that does happen. But in my, as we speak, 31 and a half years in private practice, specializing exclusively in migraine, headache, and specific upper spinal disorders, I have had exactly 3 cases in 31 and a half years where an imaging study of the head or brain or neurological testing has actually shown the real true cause of your migraine or headache symptoms. If you look in the wrong place, you're never going to find what you're looking for, and that is the real true cause of your migraine and headache neurological symptoms. So, doctors of all specialties, and again, we work with some amazing specialists here in the Kansas City area and in the Midwest. And furthermore, many of my patients travel great distances to the Kansas City area to my practice, and I am honored and thankful for their confidence and trust in my practice. But the majority of them have already sought the advice and sought treatment from neurologists or pain specialists or chiropractors or their primary care doctor with continued failing results. That's why they seek help in our practice in the first place. Yet, when we review medical records, again, including examination procedures, imaging studies, they all appear to be unremarkable the vast majority of the time. If you look in the wrong place, you'll never find what you're looking for, and that is what is going on inside of your body that's resulting in the migraine and headache symptoms in the first place. So, according to decades upon decades upon decades of proven, published medical research, the vast majority, and according to a recent study, more than 70% of migraine and headache symptoms do not originate from a head problem. That's right, your migraines, your headaches may not be a head problem, but rather spinal compression or spinal canal compression resulting from a specific upper spinal disorder near the junction where your brain and spinal cord meet, near the base of the skull. And by the way, I've got to say this doesn't necessarily mean that you are going to have symptoms in the neck. So about 20 to 25% of our patients, despite having one of these specific upper spinal disorders, do not necessarily have neck symptoms, neck tension, neck pain, shoulder tension, shoulder pain. So yes, that does occur in many of the cases, neck and shoulder tension, but it doesn't necessarily have to be the case when you have spinal compression, migraines, and headaches. So, let me cut to the chase. If the neurologist is not a true migraine or headache specialist, but rather a specialist in true neurological disorders that can be pinpointed with certainty on imaging study of the head or brain and upon neurological examination, absolutely you need to consult the advice and follow the recommendations of a reputable neurologist or neurological consultant. However, if you don't have a true neurological disorder but are experiencing neurological type symptoms, the chances are more than 70%, according to the most recent research, that you have a specific upper spinal disorder resulting in spinal compression that then results in your migraine and headache symptoms, neurological type symptoms. Thus, the medical term neuromusculoskeletal disorder, or neurological type symptoms resulting from a specific structural disorder of the upper part of your spine. And let me tell you one reason why this is so prevalent. Many of us visit our primary care doctor for periodic checkups because that's what the medical community recommends. Many of us visit our dentist for regular dental checkups because that's how we prevent cavities, tooth decay, and dental problems. Yet, the vast majority of Americans do not have regular checkups on their spine, despite the spine being the structure that supports your entire body throughout your entire lifetime, and, listen to this, most importantly, houses your spinal cord and nerves that control every single vital function of your body. Your breathing, your heart rate, your blood pressure, symptoms that you're experiencing, again, could be migraine and headache symptoms. This is absolutely critical that we receive periodic checkups on our spine just as we do our teeth and our overall physical health. It's an absolute have to, and it's not optional. So it can't surprise someone if they've never had regular checkups on their spine that they now have ended up with a spinal disorder resulting in migraine and headache symptoms. So let me wrap this up today. The reason that a neurologist is not a migraine and headache specialist is that they should specialize exclusively in identifiable neurological disorders, when neurological examination or imaging study can pinpoint the real true cause of that neurological disorder. However, when we continue to battle ongoing migraines, headaches, and by the way, this includes the associated symptoms, which are numerous and can include brain fog, dizziness, vertigo, feeling sick to your stomach, vomiting. All of these are associated symptoms with upper spinal disorders resulting in spinal compression. So you absolutely, positively must seek the help not solely of a neurologist, not your primary care doctor, not a chiropractor, not a physical therapist, not a pain management specialist. Everybody is more than happy to treat or manage your symptoms with whatever type of treatment or therapy it so happens to be that they provide. There are countless ways to treat or manage your migraine and headache symptoms, all the while ignoring the true cause. So you must seek the help of a specialist that not only is an expert in migraine and headache disorders, but that also specializes in the specific upper spinal disorders that result in your migraine and headache symptoms. This is all that we do at Headache Relief Center, and again, quite frankly, I feel it's what we do best. Our results are not a coincidence. So please, I strongly suggest and beg you to share this podcast, share our website, onlineheadachedoc.com. As I mentioned last week in our 20th episode of the season, in the coming days, we will be adding 1 or 2 new features to the onlineheadachedoc.com website, so those that are not in the Kansas City area can actually get a step-by-step, easy-to-follow guideline to know where to go, what to do, what can you do starting right now today to lead yourself in a direction toward proven, significant, long-lasting relief from your migraine and headache symptoms. Look, the only thing that matters to me is you getting the results that you're looking for and you getting the results that you deserve. Put the skepticism to the side. Much of the skepticism patients have in my day-to-day practice is instilled in them by their doctor that they're currently seeing, and that the doctor who is currently failing them with countless drugs and medication. Medication is fine to temporarily manage your symptoms while you are addressing the real, true cause. Drugs are not designed to be a long-term fix. There has never been a magic pill, shot, or potion. There isn't a magic pill, shot, or potion. And by the way, there never will be a magic pill, shot, or potion that will address the real, true cause of your migraine and headache symptoms. Thank you for listening. I look forward to visiting with you next week. Please share this and check out onlineheadachedoc.com in the second and third weeks of November for our new features to guide you step by step. As always, I'm Dr. Scott, your online headache doc, and those are the facts. And everything else? Well, it's just another opinion. The information contained in this podcast is for informational purposes only and is not meant to substitute for your doctor or healthcare provider's advice or recommendations. It is based on Dr. Scott's personal experience battling debilitating migraines for years, as well as his more than 31 years in private practice, specializing exclusively in migraine, headache, and chronic pain disorders. Copyright 2024 by Milagros Media, LLC.